support and commitment. And as you said, I fully agree, the best case ever, and it has to be supported. Thank you so much again. It's now my great honor to introduce Dr. Zweli Mkhize, Minister of Health of South Africa. Your Excellency, welcome, and you have the floor. Thank you so much for your support also. Thank you.
Thank you very much, Dr. Tedros, the Director General of the WHO, and all the members of the WHO team, my colleague, the co-chairperson, Minister Doug Inge Olstein. Thank you very much for the opportunity to be part of this very special occasion, this briefing. If there was ever a case for solidarity and global cooperation, this COVID pandemic has demonstrated one. The crisis is hitting the world hard and our most fragile regions harder, affecting income, health, education, and other parts of our socio-economic lives. COVID-19 does not respect national boundaries, and as long as it exists anywhere, it is a threat everywhere. No one is safe until everyone is safe. Global solidarity isn't just the right thing to do. It's the smartest thing to do, ensuring that tools are allocated equitably, not based on income, but based on universal protection against COVID-19, is the fastest and most effective way to defeat the pandemic and get our lives and our economies back to normal again. We must treat access to COVID-19 tools as a global public health initiative. Collective efforts to stamp out the virus now would also mean that future deadlier strains or mutations that are more difficult to treat could be avoided. It is clear that every country will need to play a part in financing an end to this crisis, and every leader has a political choice to make. But the lack of adequate financing for our global exit strategy, the ACT Accelerator, is an existential threat to the economic and health security of all countries and their citizens. Speaking from the perspective of the African continent, it has now recorded over 2 million cases with 49,000 deaths, which is accounting for 2.5% of the global caseload. There are early signs of resurgence as 18 countries, which is 38%, more than 20% increase are recorded in numbers the last 7 days when compared to the previous 7 days. It's also not certain how a resurgence on the African continent will evolve, and therefore early equal access to vaccines and therapeutics will be critical in mitigating the threat posed by the resurgence on the continent. As part of these preparations, President Ramaphosa, His Excellency, as Chair of the African Union, established a COVID-19 African Vaccine Acquisition Task Team to lead this effort. In addition to equitable access to COVID-19 tools, we also need to pay attention to the strengthening of health systems. The ACT Accelerator offers a clear way forward for ending the crisis through global cooperation that will deliver all countries need to end the acute phase of the pandemic, restoring economic vitality and averting catastrophe. And whilst the pace of scientific research and development into effective vaccine therapeutics and diagnostics is unprecedented, its true value will only be realized if countries can access these tools and are prepared for their use. Every country has work to do to ensure that once ready, these tools can be rapidly deployed. This includes ensuring that capacities and infrastructure that need to be radically scaled or upgraded to deploy COVID-19 tools are ready and working. Bottlenecks in key areas of health systems such as data, workforce, clinical care, supply chains, as well as access to key commodities such as PPEs, oxygen, remain limiting factors to effective deployment and use of COVID-19 tools in many countries. The Health System Connector pillar of the ACT Accelerator is the critical mechanism to support countries to bolster and strengthen through a tailored approach that uses global knowledge to address local problems. countries' readiness is an absolute prerequisite to the equitable scale up of the COVID-19 tools. It is a hurdle we must clear if we are to win this race. And this is one time where we all need each other and every country matters. And therefore we need to make sure that we focus on more and more partnership, solidarity, and global cooperation. Thank you very much, Dr. Tedros, for inviting us. Thank you.
Thank you. Thank you very much, Minister Mkhize, for your support and commitment. And I look forward to working with both of you in this very critical period to realize the promise of the ACT Accelerator. Thank you so much again, and I hope you will stay with us for a few more minutes to answer if we have questions from the media. And with that, back to you, Margaret.
Thank you very much, Dr. Tedros. So yes, we will now open the floor to questions. I think I probably don't need to remind you, you need to use the raise your hand icon to get in the queue. We already have a large number of you in the queue, so I ask that you restrict yourselves to one question. Remember, we also have our experts on the line and in the room, so indicate clearly what your question is. And we have limited time, so please keep your question short. So I will stop talking now and give you a chance to ask your question. The first one goes to Corinne from Bloomberg. Corinne, could you unmute yourself and please ask your question?
Hi, thanks for taking my question. It'd be great to get your take on the AstraZeneca vaccine results, especially since it said that they're going to try to get a quick recommendation from the WHO. And it seems like the results are not that straightforward.
So that question, I think, will go to Dr. Soumya Swaminathan. Dr. Soumya, are you on the line?
Yes, I am, Margaret. And thank you for that question. First of all, I'm sure the person who asked the question, like all of us, is very encouraged by the news that we got today. The preliminary results that have been released from the clinical trial of the AstraZeneca vaccine, following on the encouraging results from the two earlier vaccines, the Pfizer and the Moderna, both of which are mRNA vaccines, the AstraZeneca vaccine being a viral vector vaccine. So I think the good news is that vaccines for COVID-19 disease is possible to make, and it's possible that we will have a number of different vaccine candidates that can be used in the fight against this disease. And as we're discussing the ACT Accelerator today, I think this is very relevant because we would like to provide access to as many efficacious and safe vaccines as possible so we can cover the population around the world. Remember, we have to cover a huge number of people, billions and billions of people. This is unprecedented. And we will need all the manufacturing capacity in the world to be able to do that. Now, on the AstraZeneca results itself, we've heard only the preliminary results about the vaccine trials that were done in the UK and Brazil, looking at two slightly different dosing schedules. And the schedule that had the two doses of the same dose given 2 times had a slightly lower efficacy, but still it was about 62%, which is above the benchmark that we had set. But the schedule which gave a smaller dose followed by a larger dose, actually the efficacy seems to have been higher, up to 90%. But again, this is based on rather small numbers. And I think we need to wait to see the results, both of the efficacy and the safety. The AstraZeneca vaccine is also being currently trialed in many other countries. And eventually we should have data on about 60,000 patients or so that will enable us really to have a much more informed decision. So we await discussions with the company, and they've already talking with our pre-qualification program on how they would go about. And Dr. Simao is available to answer more questions on that. Thanks.
Thank you, Dr. Swaminathan, and over to Dr. Simao for some added points.
Thank you very much, Margaret, and thank you Corinne, for the question. Actually, we have had already several discussions with the AstraZeneca on following the expression of interest that WHO issued for the emergency use listing and pre-qualification of the vaccines. So we are very hopeful. We are about to receive more data that includes clinical data in the next week. And we are also aware that AstraZeneca is also submitting the dossiers to the European Medicines Agency, and we do have a very close collaboration. There are actually 8 sites that, and some of them are manufacturing sites. So we will be analyzing this data with very carefully, but very much welcome the results so far. We expect that we should have finalized the assessments in the beginning of next year. Thank you.
If I could just add, Margaret, I forgot to mention the advantage of this vaccine is that it can be stored in the ordinary refrigerated temperatures of 2 to 8 degrees and is stable at that temperature. And that, of course, has huge logistical advantages for transporting and delivering this vaccine to cities and towns and villages and rural areas around the world. And we hope there will be more vaccines like that, which are more heat stable, and we have to also continue to encourage all the other developers who are doing clinical trials and who are in early phases of development, because we do need a variety of vaccines out there that will target different groups better, that will have different storage conditions. And also the issue of affordability is also important to keep in mind. Thanks.
Thank you, Dr. Swaminathan and Dr. Shimao. There do not seem to be any comments in the room. So I will take the next question from Gunilla, the Geneva correspondent for Swedish media. Gunilla, please unmute yourself and go ahead.
Can you hear me?
Yes, please go ahead.
Thanks for taking my question. It is very, very promising with the vaccines coming, vaccine candidates, but first we have Christmas, and Christmas is now about 1 month away. And countries start to give advice, like in the UK, they said that we can have an exception of 3 households celebrating Christmas together, which could be a lot of people. In Sweden, meanwhile, the Prime Minister yesterday said there should be 1 family staying inside for the time being. So I'm wondering, would you be able to give advice, recommendations, how countries should deal with celebrations around Christmas, especially in Europe that now are still